Hello, everyone, and good afternoon, or perhaps good morning, depending on where you're joining us from today. My name is Jeanette Prorok, and I'll be your host for today's webinar. Without further ado, I'll share my screen here and get started. All right, so today's CFN webinar is entitled Avoid Frailty, Community Empowered Healthy Aging. And this webinar focuses on the results from a project that we've been working on for close to, or actually about 2 years now. But before I begin, I'd just like to acknowledge that myself, as well as CFN, are situated on the traditional Anishinaabe and Haudenosaunee territory. And we're very grateful, both as an organization and myself as an individual, to be able to live, learn, and play on these lands. And I encourage anyone who wishes to share where they're joining us from as well. In terms of what we'll be covering today, we'll start with an overview of the project and what it's really all about. And then we'll get into understanding the experiences of older adults. So what did we hear from the older adults that we spoke to throughout this project? And then we'll go over sort of the proposed design and the next steps. So hopefully that will become more clear as we progress through the presentation. So in terms of the project overview, the HCCF, or the Healthy Canadians and Communities Fund, is administered by the Public Health Agency of Canada, and it has three main objectives. The first is to invest in interventions that address health inequalities. The second being encouraging multi-sectoral participation in chronic disease prevention. And then the third one is to uncover new ways to address the risk factors for chronic disease. So really, this fund is focusing on preventing or mitigating chronic disease across the whole population of Canadians. And as you'll see, our project focused specifically on older adults. The way the HCCF is administered is it's a three-phase funding model. So the first phase of funding, which is what we'll be presenting the results of here, is called the design phase. So the Public Health Agency of Canada has given a number of organizations funding to design an intervention that addresses the objectives stated above here. So focusing on health inequalities, chronic disease prevention, and ways like that. Once projects complete the design phase funding, they have the opportunity to apply for implementation phase funding. So that second phase of funding allows you to actually take the design that you've been working on in that first phase and implement it in your local target population. And then once the implementation phase is done, depending on what your results are, hopefully you have positive results going forward, you can apply for scaling and spreading that more broadly throughout Canada. The projects that are selected for the Healthy Canadians and Communities Fund uh, program have to address one or more of the following behaviors: unhealthy eating, physical inactivity, and smoking. So those are three key behaviors that have really been found to lead to a number of chronic diseases. So in the vein of trying to prevent chronic diseases, the fund focuses on these three key behaviors. The projects must also identify a priority population that is experiencing health inequities, again, to meet with those objectives of the funded phase. So the healthy behaviors that we focused on in our project were unhealthy eating and physical inactivity. Some of you may be aware of the Canadian Frailty Network's Avoid Frailty public health campaign, which focuses on activity, I should say, avoid is an acronym that covers 5 key behaviors, and those behaviors are activity, vaccination, optimization of medications, interaction or reduction of social isolation, and D, diet and nutrition. So CFN had already started to gather and gain quite a bit of experience in those areas, working with older adults and intervening in those, both to prevent frailty and enable healthy aging, and also reduce risk of chronic disease. So this seemed like a natural fit for our organization to proceed with this project and this funding. So we decided to focus specifically on unhealthy eating and physical inactivity. And our priority population, or our population that was experiencing health inequities, was lower. We selected lower income older adults in the Kingston, Frontenac, Lennox, and Addington region. So Kingston city proper and some surrounding rural areas there, as well as also older adults living in rural and remote areas, because we know that those individuals can experience um, health inequities as well when it comes to programming, etc. We received funding in February 2022, and that funding goes until the end of next month, March 2024. So that's been our project duration. We had a number of partner organizations that have been involved in this work. It includes the City of Kingston, the Kingston Community Health Centers, the Victorian Order of Nurses, Queen's University, the Center for Studies in Aging and Health at Providence Care, KFLNA Public Health, as well as Rural Frontenac Community Services and Southern Frontenac Community Services. And I'd really like to acknowledge these partners for all of their support over the past 2 years of this project. It's been wonderful working with them, and we hope to continue working with them and even further community partners in the second phase of project funding. So moving into understanding the experience of older adults. So as I stated earlier in this webinar, um, this phase of HCCF funding really focused on design phase. And as you saw in our title, we called it community enabled or community empowered healthy aging. So we really wanted this to be designed by older adults for older adults. So that meant that we conducted a significant amount of community consultations and community needs assessments, to hear from older adults themselves what's missing, what's needed, and how can we design an intervention that they will find useful and beneficial to them. So as I mentioned, there were a number of activities. We began with conducting a community needs assessment, which was completed by 60 older adults. We also did some telephone surveying where 86 individuals completed the survey. 813 completed an online survey. Recognizing that not everyone has access to technologies, we conducted a number of in-person events all throughout the region, into remote areas of KFLNA, a number of focus groups, both in urban and rural areas. And then we also had interviews with stakeholders from each of those community partners to hear from them what do they feel is missing, what can be done, how should this be designed, and what should this look like. I should also say that this project was guided throughout by three advisory groups. The first was an advisory group of the community partners, so representatives from each of those organizations on that earlier slide. Those individuals met quarterly, and they were provided with updates on the project progress, as well as opportunities to provide feedback and inform the design as the project progressed. We also had two advisory groups, one being the Urban Community Advisory Group and the other being the Rural Community Advisory Group. And each of those advisory groups were older adults living in either the urban or rural areas of Kingston, Frontenac, Lennox, and Addington. And those groups met monthly, and they did a lot of the legwork and a lot of help in terms of designing our final proposed design and intervention. They were instrumental in getting surveys out or needs assessments out into rural areas where they lived, as well as providing a lot of input and informing interpretation and analysis of results from these consultations. So it was they were an invaluable contributors to this project, and it's been wonderful working with both of those groups. They were created as separate groups, urban and rural, because as mentioned, there are sort of different challenges in each of the areas, but on occasion, the groups did elect to meet together to sort of put their heads together to address common challenges, and to think about cohesiveness in the design and any modifications that might need to be made for either group. So what I'll share now is results of what we heard from the survey in terms of older adults' experiences with physical activity and nutrition intervention and programming here in KFLNA. So, one of the questions we asked participants was whether they were aware of physical activity and nutrition programming in their community. And what you'll see here is that in green you have physical activity. So you have just over half agreeing or strongly agreeing that they're aware of physical activity programming. But when you look at nutrition programming, that drops drastically. So only about a fifth agree or strongly agree. Most people really haven't heard of any sort of nutrition focused or nutrition based programming that's happening in the region. In terms of satisfaction, as you'd expect, especially largely given that they're not as familiar with the programs, and then those that do go aren't that satisfied with what's available for nutrition-based programming. And looking at physical activity-based programming, there's definitely room for improvement there as well. We've also asked, especially given our priority population, whether programming in the community is affordable. And as you can see from the data here, for both physical activity and nutrition-based programming, it was a minority of participants who felt that this type of programming in their community was affordable. Transportation can also be a significant concern, particularly in rural and remote areas. Um, when we asked whether transportation to community programs was accessible, only about a fifth here that agreed or strongly agreed. Most were on the fence, and then we had um, about a third who disagreed in terms of transportation to community programs being accessible. We also asked about walking paths and sidewalks in neighborhoods because we know that walking can be is a great activity and can be something that people enjoy doing, but our neighborhoods may not always be conducive to that, particularly for any sort of mobility impairments or concerns that individuals may have. So when we asked if people are satisfied with the amount of walking paths and sidewalks in their neighborhood, we had a fairly positive response. Just over half were satisfied with walking paths and sidewalks in their neighborhood, and a large proportion, almost two-thirds, make use of walking paths and sidewalks in their neighborhood. The surveys and communities assessments that were conducted also included a number of open-ended questions, essentially asking sort of what's missing, any other thoughts or comments that they had. And these are the general themes that came out from those open-ended questions. The first was access to programming, that they feel there needs to be greater access to programming. There also needs to be more affordable programming. We also discovered that there was a lack of awareness or information or communication. And this is an example of where having that older adult advisory group was extremely helpful. For example, an individual in a certain area on the survey may have replied, "We really need more Tai Chi programs." And our older adult advisory group members, who are quite well connected individuals in their communities, were able to say, "We do have that. It's here at this time." But that signaled to us that that information is just not making it out to the individuals who need it or are seeking it. The other piece of information we found was that there needs to be more encouragement, more engagement, more motivation to get people out there to any sort of programs, whether it be physical activity or nutrition based programs. We also learned that there's a lot of areas in our community that perhaps could be better utilized to help enable healthy aging. So, making use of libraries, which are found all throughout our region, including the rural and remote areas, community centers, as well as churches. Transportation, as we saw, several people referenced needing transportation. Just recently, we even heard about from a group of older adults about a local community center that doesn't actually even have a bus stop near it. So, things that need to be done in terms of that to help facilitate, again, back to the first point, access to programming. And then individuals also brought up perhaps linking with other individuals in the same neighborhood. So maybe there's someone right under your nose or right in your community who's looking to do the same thing as you, but there's just it's lacking in the connections there are lacking, or you don't have a way of making those connections with individuals who are interested in doing the same thing as you. As I mentioned at the start, CFN has been working on avoid frailty for quite some time. And as part of this, we created an avoid frailty program and an avoid frailty website. And some of you on this webinar may have accessed that yourself. We did get some feedback from our community advisory groups, indicating that it can be technically challenging. It's perhaps a bit more developed for the urban area, which we acknowledge this. The initial database was focused more on urban areas, and it was only beginning to expand to more rural areas. It required an extensive and detailed assessment of personal information, which can be time consuming. The website has quite a bit of information, but in some instances, it can also be overwhelming. And what our participants told us is that this design needs more of a bottom up, not top down approach. When we spoke to our community partners, they let us know that really what's needed is a multi-pronged or multi-method approach, not just tech-based. So not relying solely on a website, but that we need to make use of multiple methods of engagement, things like, as I mentioned, the libraries, community newspapers, different ways of getting information out to individuals that aren't necessarily connected through the tech-based avenues. This will require coordination between community partners. And our community partners also said that there's a need to connect existing resources together. So perhaps there's organizations that are working towards the same goal, and same thing, but maybe we can work on that together. And that ties to this last point. Many community partners are also trying to build greater awareness and reach of their programming. So some of our community partners do offer and run programming themselves, and they're trying to reach the same individuals that we would be targeting with this program design. So rather than working in parallel, let's work together and reach those individuals together so that we can improve older adult health in our region. So all of this led us to the question, the key question being, how can we bring together community organizations and resources that are focused on physical activity and nutrition in a user-friendly, low-cost way to improve older adult health and reduce the risk of chronic disease? So that led us to our proposed design. So this is a screenshot of a one-page summary that we created of the proposed design. And the proposed design, we're calling it the Healthy Aging Connection. So promoting healthy aging to the older adult population in KFL&A. So CFN, as I mentioned, is designing this new program called the Healthy Aging Connection. And really, what it aims to do is make connections between older adults and physical activity and nutrition programs and resources to optimize healthy aging. So that's what we found when we were looking at all of the data. We realized what we need is a way to connect everything that already exists, because we have a wide range of resources and programs in the community. Um, but they just need to be connected in some way and connected to the older adults themselves. So, one thing I should have mentioned, so this project also included an environmental scan. So early on, we conducted an environmental scan of all the different physical activity and nutrition programs in our region, and we found over 250 programs. And those were vetted by the older adult community advisory groups for relevance and whether they felt that they should be included in any sort of database or of existing programs. So we have that information available and ready. And so we know that these programs exist, but it's about how do we get the information to people. And so that's where we came up with the Healthy Aging Connection. You may notice, or you may be wondering, why the change from avoiding frailty to healthy aging connection. And we also heard from a number of people that they'd like to have more of a focus on the positive, focusing on healthy aging as opposed to frailty, which unfortunately is still a word that many people hesitate with. So focusing a bit more on prevention and enabling healthy aging as opposed to um, focusing on frailty. So the proposed design would have a number of components. So at the center, we have the Healthy Aging Connection, which is really a community health promotion intervention that would involve coaching and education. And the first piece that I'll talk about is the tech focused piece, which is the interactive website. So this is some spot where individuals could go to find information on healthy aging, connect with community programs and services. So access that database that I just mentioned that we had identified. Um, they could access educational modules, find resources that we have on the website related to physical activity and nutrition. And they could also have the option to complete a healthy aging assessment to learn how they can improve their health. The second piece is community engagement. So, um, in speaking with our advisory group members and people throughout the community, they suggested having healthy aging connection information boards throughout the community. So, whether that be in the libraries and the number of local newspapers that we have, somewhere where people know that they can go regularly to find information about what's happening in our communities. Um, and also they did discuss having regular monthly events. So we need to host these in a number of locations throughout KFLNA because it is fairly geographically large so that we can ensure that individuals can access these monthly events. But it would also be an opportunity to bring people together and re-engage them with the program and provide that sort of as I commented on earlier, provide that engagement, motivation, and also allow you to link with individuals in the community. These haven't quite been fleshed out yet, but what we anticipate them looking like is they may be something like um, a light level exercise class or stretching followed by a meal together, which will also provide opportunity for socialization. Or they could be educational sessions followed by a healthy meal together after. And of course, with the focus on everything being affordable and available to anyone who's interested in the community. The final third component is peer supports. So allowing forums and opportunities for individuals to connect and encourage one another to meet their goals and age healthily together. So, what we heard, especially from our rural participants, is that things often aren't formalized programs. There might be a group who gets together and walks every Thursday at 10 a.m., but they don't have a website and they don't have uh, it's not a formalized program, but they're willing to take anyone with them who'd like to go and join. And so the way that gets around right now is mainly by word of mouth in those groups. So finding ways that can be done. So whether it's forums to connect, and I know some of the rural organizations have experimented with this a little bit, and I think we'd build on that with our partners on individuals saying they've done it sort of in a ride sharing capacity, for example, where someone's saying, I'm heading into the city of Kingston on Thursday at 10 a.m. Does anyone want to join or need a ride into town? So in the same vein, someone could say, Thursdays, we're going for a walk at 10 a.m. at such and such park. Anyone who wants to join is welcome to come. And so ways to help people make those connections and allow individuals to learn what's happening in their community. Um, we would also include a peer coaching component, so where there's individuals who can help motivate and support older adults towards their goals. So let's say you might have someone who wants to try a new type of class, but it can be challenging or difficult to take that first step and go on your own. But perhaps the peer coach is there to help you make that first step towards that healthy behavior. Um, so this is a sort of a handout that we've been distributing through events that we've been doing in the community, gathering feedback, um, and continually revising as we work towards a final design. This was another version of it that we used a bit more internally with the advisory groups, and they helped provide feedback to get it to this point. So this has been through a number of iterations, but essentially it summarizes the intervention another way, and just includes the purpose of the program as well as who our target population is. But you'll see it's essentially the same information on healthy aging, a database, an assessment, forums to connect, peer coaches, regular monthly events, and finding ways to engage in the community through that multi-method in multi-pronged approach where we're not just focusing on a solely technological focused approach. So in terms of the next steps that are happening with this project, from now until the end of March 2024, so we're not that far off from there, we have ongoing evaluation activities happening. So that's been a component of this project as we've had a third party evaluator along for the ride throughout the 2-year duration of the project. And that person has been looking at, are we reaching the populations that we're needing to? Are we designing a program that's feasible, that's sustainable, that's relevant to what has come out of the data and what we've heard from the communities? So there are some final ongoing evaluation activities still occurring. Um, in March 2024, perhaps early April 2024, we'll be submitting a final report to the Public Health Agency of Canada. And what we've heard from the Public Health Agency of Canada is that in early April, we can expect a call for proposals to be released for that implementation phase funding, at which point we could begin working on our proposal, our proposed design, and submitting it for implementation phase funding so that we could implement the Healthy Aging Connection here in KFLNA. And so that is the end of my slides there. Looks like I'm right on time because I hoped to leave some time for questions there. So if anyone has any questions, feel free to type them into the Q&A or into the chat, and I'll keep an eye on both of those right now. No questions? Oh, let's see here. When will you learn if you're approved for implementation? So, what they've told us is that they anticipate that um, proposals, so the call for proposals would come out in April, and they anticipate that projects would start in November. So usually it takes about a month to sort out the contracts, etc. So I'd anticipate that they'd let us know early October so that then we could start November 1st. But sometimes there can be delays with these sorts of things. Fingers crossed that there isn't, but that's what we've been told by our contact at the Public Health Agency of Canada. Right. Well, if there's no further questions, then I think I may just thank everyone for their time and attention today. And if you do have any questions that come up, or if you'd like to reach out with any comments, I'll put my email there in the chat right now, and feel free to reach out if there are any thoughts or comments you have after the fact that you'd like to share, because we'd be happy to hear from you. Thanks so much, everyone.